A little bit.
Did
Okay.
you start the broadcast?
No, I didn't. No, I didn't.
Can
Um,
I
You want
undo
me
it?
to? I actually started it because I couldn't hear you guys unless I started it. You want me to stop it?
yeah. Yeah, we
Let
wanna
me
we
see if
wanna
there's a
show
way
our
to
deck.
pause. Hey, good morning, everyone. Thank you for joining us. We're just about a minute ahead of schedule, but we wanted to open it up so you can see the screens and our faces on this, depending upon where you are. Cold, dark, and dreary day in Cleveland. Cincinnati may have had rain overnight also. And Phil, it looks like it's sunny in his part of the world.
That's
So
correct.
that is correct. He's not in Pennsylvania. Um, anyway, so we're going to get started. Phil Mishler is our carrier rep for Allstate, which was formerly National General. That's the guy. He is, they have a realm of products. They've got their dental vision plans, hearing in some states, I believe. They've got accidental death, critical illness, and other indemnity type of plans. And so that's what he's going to really key on today, too. And he will obviously cover short term. And in case you didn't know it, Allstate sells Medicare supplements. So they're in the Medicare space a little bit. And our other Cornerstone in Ohio actually works with them for the Medicare supplement. So maybe Phil will even touch on that just a wee bit as an informational piece on how competitive rates are and stuff like that. All right. So where am I actually? Next slide, Brad. Oh, well, I guess I did that wrong. So short term and ancillary. Housekeeping. There's a chat box and a question box. If you put any of your typed questions in the question box, it's got the little question mark in it. That's an easy way for us to read them. And when there's a break in the action, we can ask Phil or wait until later. So be patient with us. I almost rather him go through his spiel, um, and then we'll get the questions answered after the fact. Because if you're thinking them, he probably has it on his mind to cover it in a later slide. So just hang tight. So that's the housekeeping. And if you didn't know these two bald guys, that's Jeff and I. There was going to be a whole podcast series we were going to do last year. We got all the graphics laid out for it, everything, the name. We just never found the time to actually record it, but you never know. After the big Northeast Ohio Cornerstone Expo in April 25th, if you have not registered for that and you're within 60 to 90 minutes drive, Phil's going to come up from or over from Philadelphia or maybe Florida, depends on where he is, to be there. So if you go out onto the Cornerstone webpage resource center, you will be able to still register. Although we're not marketing it as your last chance, we're leaving it open until Thursday. So if you haven't, it would be a really great idea. We have 12 carriers coming, plus 5 other vendors. So it's going to be an action-packed day. There's going to be food. There's going to be some beverage later. No drinking during the day. No day drinking, I guess that is. So, so yeah, just make sure you do that if you haven't already on the website. You should have all gotten, many of you should have gotten paper invitations, like you were going to be invited to a wedding. So, all right, Allstate, Phil Mishler, take it away.
All
We
right.
never really practiced you. I'm going to unshare my screen so you can share yours.
Hold on now. Let's see.
Lower right hand corner. Yep, there you go.
How's it look?
Yep, good, 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 good.
All right. So, welcome everybody. Thank you for carving time out of your week to be here. I've looked at the list of agents who are on the call. I recognize some of the names. So for those of you who have written business with us, thank you for your business. If you're new, today we're here to talk about short-term medical and our supplemental products. Also, some people call supplemental ancillary. So if you have a question, please chat it out. I'm looking forward to sharing these details. So here we go. So for those of you who aren't familiar with my team, this is my team. My team has over 100 years of combined experience in the health insurance space, both group medical, individual medical, and Medicare. So I'm on the call by myself today, but if you need help with our products, Nancy, Brittany, Tabitha can help. And then Jen Pasquale does our senior products. And speaking of senior products, if you are in the senior space, this coming Friday, so 3 days from now, we are launching Final Expense Life Insurance, which is somewhat of a senior product, but if you're in that space, stay tuned. So that's the team. I love my team. And when you look at this team slide, the only thing that I would ask that you think of is just think of these people as a group of folks who care, just like Cornerstone. So, all right. So short-term medical. For those of you who don't know, we do have a plan called Copay Enhanced that has a $5 million maximum. And the two plan designs in most areas of the country are this $6,000 and $8,000 deductible and 100% coverage thereafter. So if you have people who are, for lack of a better way to say it, copay junkies, or they really appreciate having a $5 million maximum, then this copay enhanced, maybe for them. And I only have a few slides, folks. I'm not going to slide you to death today. I'm hoping to do most of our work in the software. So let's see what else we have. So one of the hallmarks of the copay enhanced plan is it actually offers copays, $40 primary, $60 specialist, and it actually has a real $10 generic drug card. The way the drug card would work under this program is, let's say you're picking up a generic drug that might cost $40 normally. The customer's only going to pay $10, and it's that $40 that credits towards a $3,000 maximum. It's also important to note that the pharmacy benefit on the copay enhanced PPO will cover medications for pre-existing conditions. There's only one catch to that. In order for the drug to be covered, it has to be a covered medical expense under the plan. So a good example would be mental nervous drugs. You're not going to be able to pick up a mental nervous drug under the $10 generic with no pre-existing because it's an excluded charge under the medical plan. So hopefully that makes sense to you. There is a limited number of copays. So if your customer has a policy lasting greater than 6 months, each person in the family gets the option to use 2 copays when they're with us. So it's not unlimited. There's actually a limit. This is where I think the smartest money for our plan is, as long as your customer can live with a $1 million maximum. We still sell plans that, like, so if you don't like to explain what coinsurance is to your customer, you don't have to. You could offer them a $2,500 deductible 100%, or even a $5,000 or even higher deductible 100%. But if you're looking to skinny down the rate, you may want to consider a 50-50 coinsurance, because in a catastrophic claim, it doesn't matter whether your client has an 80-20 or 50-50 coinsurance with us. The out-of-pocket is the same. All right, so these are general benefits. All of our plans cover office doctor visits. It's just a question of whether it's going to the deductible or coinsurance, or it's actually a copay item. We offer unlimited urgent care copays of $50. The $50 is to walk in the door and get diagnosed. If the urgent care is doing other things to you while you're there, like MRI, CAT scan, or lab work, those charges are going to flow to the coinsurance. So it is a little known fact. If you have a prospect who is telling you in the interview that they spend a lot of time in the urgent care, maybe they have kids with sports injuries, I would recommend you consider 100% coinsurance, so that when that particular family hits the urgent care center, all they'll ever pay is $50. So I hope that makes sense to you. You'll see an emergency room listed here. They make it look somewhat like a benefit, but it's really it's somewhat of a negative. If your customer uses the emergency room and they're not admitted, they owe their deductible, the coinsurance, and then the $250 access fee on top of that. And at the bottom, you can see there, diagnostic X-ray and lab is subject to deductible and coinsurance. In the past, we only covered the test, but not the interpretation. But we've made some changes, and now we cover both. This is probably the strongest part of our short-term medical offering. If you're sitting in Ohio today and maybe you're selling Affordable Care Act individual plans, you know that for the most part, many of those plans have a local-only network. So the biggest benefit to our short-term medical plan is your customer is plugging into either the Aetna network or the Cigna network. Here on the East Coast and in Ohio, most of the business is flowing to Aetna. In our areas here, Aetna is a great network. Aetna is going to give your customers access to all the centers of excellence that matter. So Mayo Clinic, Sloan Kettering, Cleveland Clinic, Johns Hopkins in Maryland, MD Anderson Cancer Center in Texas. It's America's best cancer center. So if you have customers who are looking for a robust network, bigger than the one that they can get from a local carrier in Ohio or even a blue carrier, this would be the network. So for those of you who are new, in the state of Ohio, in order to get our short-term medical plan, we force your customer to join what we call our life association. Life association membership comes with a bunch of benefits, but really the two that are worth mentioning is this is where your customer gets their telemedicine benefit that's free to use. So instead of going to see a doctor, you call a doctor and they can prescribe non-narcotic. They can diagnose and prescribe non-narcotic medication right over the telephone, and it costs your customer nothing. The other primary benefit that comes with this, and it's not even listed on this page, is this is where your customer gets their discount prescription drug card. If they didn't buy a copay plan, they're getting a discount prescription drug card. It's part of this life association. So you're getting your customer gets all these benefits for $15 a month association fee. So our short-term medical will do child only applications. They just have to be over 60 days old. And you can see that these products cover very similar to an ACA plan, whereas we'll cover dependent children through age 25. So we have a pretty easy, well, I guess I should backtrack and just say this is a simplify issue plan. You check no to the 4 health history questions, we issue the coverage. And when it comes to build, we don't have a build chart. We just have this. If you're under 300 pounds and you're a male, you're eligible. And if you're a female under 250, you are eligible. Now, this last line here, it doesn't apply in Ohio because we no longer have we used to have a guarantee issue short-term medical. So ignore that last line, please. All right. So these are the health questions. So there's 4 of them. So the first one is, I know you folks can read, but I wanted to point out it's anyone who's pregnant or an expectant father. We just won't take either one due to the risk of premature childbirth. Then you'll see the AIDS and HIV question. And then the third one here that you're looking at is simply going to say, hey, did your doctor tell you you need something taken care of that you haven't gotten done yet? So those are the first 3. And then this is the big one, last 5 years. And you can read, and these are pretty serious things, heart, stroke. But But the ones that diabetes is one, but the one I think that trips people up that they're not always expecting is this one that says neck back disorder or joint replacement. So when you're looking at this, and remember these questions go back 5 years. So please don't come to me and say, hey, my customer had cancer 5.5 years ago and they're out of the woods. Well, typically, and I'm not a medical professional, but a lot of times when you have a condition like cancer, you have follow-ups that go beyond just a couple of years. So your doctor might say to you, hey, you need to come see me twice a year for the rest of your life for the cancer. So just be careful when you're going through these questions. It's very rare, but occasionally we find someone that maybe misread one of these questions that results in their policy getting canceled and after the fact. So just be careful, and if you're not sure, call and ask. That always seems to work the best.
Phil, that looks like quite very similar to a MedSup application, like almost identical to what I was used to from my former life.
Yeah. So
Yeah.
I guess all these insurance companies copy each other in our business.
Yes, exactly.
And so it's easy though. You check no to
Yep.
the 4 questions, it's automatic issue. The real thing with short-term medical, and I don't have a slide for this, is simply it's really a fit for about half of the people you're going to run into, right? And the best fit customer is going to raise their hand and say, hey, Brad, I'm paying too much. But then they'll follow it up with a statement like, hey, and I'm hardly ever using this. I'm paying too much and I never use it, right? Or I hardly use it. That's where you would ring the bell for short-term medical. Okay, so we do offer preferred rates. So it's a way in Ohio to get down and funky with the rate. And you can see here, in order to be eligible for preferred, they have to have any type of other health insurance 9 out of the last 12 months. It could be a religious sharing plan. It could be anything. If your customer thinks they had coverage 9 out of the last 12 months, check yes. We don't ask for proof. And then you can read the tobacco, the DUI, they cannot own or lease a motorcycle, and they can't be taking medications for high blood pressure, cholesterol, anxiety, depression in the last 5 years. And then you can see we have a different build threshold for preferred. We only issue preferred rates for the primary applicant and spouse. None of the preferred has anything to do with children. The other thing that's important to mention, and I don't have a slide for this one, is we do run a prescription check. So the second that you push the submit button, we're going to run a prescription check on your customer. That prescription check specifically is looking for mental nervous drugs. So it's very rare, but occasionally it does happen where you push the submit button and your customer, it either one, get a counter offer. Let's say you applied for preferred, but we think, based on the way they answer the questions or the prescription check, we may make a counter offer of standard, or depending on the prescription check, we might actually decline the customer. Is very rare. I just wanted you folks to know. All right, so that was what I had to say on the short-term medical. If you're new, I went through it pretty quick. Feel free to give me a call, and we can help ask other questions. Did anyone post a question, Brad or Jeff?
I don't believe so.
Look, I have no. I think
Okay,
it was pretty good pace, and the slides are really clean. Phil, will
okay,
you
great.
share us some abridged version of these slides, maybe
Yes.
in a PDF?
Yes.
Perfect.
Yes.
And then,
let me make a
gang,
WIO list here.
Yeah.
Brad.
PowerPoint. And if you
PowerPoint.
want to hear anything from Phil's lips, again, everything will be recorded or is recorded and will be available in a day or so on our resource center portal. So if you want to hear anything again, and then we'll also send that all to all the attendees as Phil's PDF. So thank you. Go ahead, Phil.
Thank you, gentlemen. Appreciate it. So I have 4 slides left. I think 4 slides. So this is a one-legged stool. This is what your customer would be sitting on if they only have health insurance and they don't have any supplemental products or any type of ancillary product. they're basically sitting on a one-leg stool. So when you have a one-leg stool, the two other legs that support your customer are their wallet, right? So you see this example here. It's a little old. It's at 9100. This is just to get you thinking about what I'm about to tell you about, and hopefully it rings true with you. And that when I was doing your job as an agent, I love my customers, and I don't want to see my customer, and I'm not going to do a lot of preaching. I'm just going to tell you, if you love your customer, you don't let them walk out the door with the $9,100 out of pocket without saying, hey, Brad, before you leave, can I just ask, what's your plan to cover the $9,100 if, God forbid, you have to use your health insurance next week, right? And what Brad's going to say 90% of the time is, well, hey, Phil, I'm hoping I won't have to use my health insurance next week. And then, of course, it's my job to say to Brad, that's a terrible plan, and you need to maybe consider a product that would help you. So speaking of products that would help people, this is what a proper three-legged stool looks like. It's got the health insurance, possibly a hospitalization benefit, and an accident benefit. So I think you get what I'm saying. I didn't want to harp on this. So what we find is, and I apologize for the bolded language here. I don't feel like I'm yelling at you. I'm definitely not yelling at you. But what I want you to do, or what I wanted to convey, is a lot of times agents that don't talk about supplemental or ancillary products, it isn't because they hate their customer. It's simply because they're not in the habit of addressing these things. So you could do what I just did in the first example, which is, hey, Brad, what's your plan, right? Or you could do what you see at the top here, which is, hey, Brad, who do you have your dental insurance with? Who's your critical illness with? Right now, if I ask him too many of those questions, Brad's going to feel like, hey, I'm cutting him down. I'm making him feel bad because he doesn't have all this stuff, right? So maybe you just want to pick one or two. For those of you who aren't familiar, dental insurance is the most requested supplemental product, and it's one of the easiest to sell because people are using, people need a dental benefit, unless you've got rotten teeth and you don't like going to the dentist. People want to take care of their teeth. So that's, if you just want to stick your pinky toe in the water, I would be like, hey, Brad, a lot of times when people buy the health insurance, they take dental to go with it. Are you interested in having a conversation about dental, right? Because that's really that's the key here. It's like, if you're not doing this now, hopefully you see something or you hear something today that reminds you, or B, you just want to have the conversation. So just to continue here, the people who do the best with this actually address the supplemental need prior to doing the ACA open enroll or the enrollment. So it would sound something like this. Hey, Brad, look, it looks like today we're going to try and find a match for you with an ACA plan, possibly with a subsidy based on your household income. But that's what we're going to talk about today. But like next week, 6 months from now, a year from now, you might wind up being eligible for a spouse, coverage through your spouse. You might become eligible for a group plan, and you might not need this ACA policy that we're going to sell you in a few minutes. But unless you go to work for the government, you're going to have an out-of-pocket on whatever health insurance you have in the future, and these supplemental plans can go with you. So before we get started, do you mind if we start there? And so that's one way. And then the last thing is just the last two sentences here on this slide. If you don't ask, you're essentially never giving your customer the opportunity. So my last words on this, other than just showing you these products in a moment, is just ask. It's okay if they say no. Understand that some people will say no. But, I think some agents have like a subconscious feeling that they don't want to sell the customer any more insurance. And honestly, I don't blame you. When you have a husband and wife who are faced without a subsidy paying over $2,000 a month for their health insurance based on their age, it's common to say, geez, I don't want to sell these people any more insurance, but you really do have to think about the out-of-pocket. Hopefully that makes sense to you. All right, so let me get out of this. And let me go over here. Okay. So this is our agent back office. This is where you would go. Oh, there it goes. Okay, let me make this bigger. Nope. All right, it's not working. There we go. All right. So this is our agent back office. This is where you could go to see a list of your current policies. This is where you could start a list bill. For those of you who don't know, we offer a list bill for all of our products with a minimum of 2 people taking it. So if you work with employer groups or associations or affinity groups, you could actually click list bill, type in this basic, very, very basic information, and click send invitation. And that's how you would set up the list bill for your customer. And then if we just go back here for 1 second in the back office, you have all these quick links to our market materials, your commission statements. And if you're the type that reads underwriting guides and things of that nature, that's all listed here too. But for today's purposes, we're just going to click quote and enroll at the top here. And this is going to bring you to our quoting system. Now, this is somewhat of a new quoting system for us. We launched it last year. It had, if you've been writing with us, you know there was some bugs in this system that we're able to beat most of the bugs out of the system, and so now it's good. But I can tell you, in my career, I've seen hundreds of quoting softwares, and I think this is one of the best that I've seen. But if you're yes,
Can I jump in here? What is the address, the URL for that website?
oh, that's a good question. Okay, hold
I'm
on.
sorry. There is
okay.
like an old
That's okay.
quoter out there. So this
Hold
is.
on. So it's this right here. It's a mouthful. If it was my company, I would change it to, quote.
It's NGAH.
Yes, which stands for National General Accident and Health Agents. We're not even National General anymore. But anyhow, that's the website. So you would go here.
Okay.
And you would click quote and enroll. Let me make this bigger here. Oh.
And Jim, we'll get to your question in a little bit. You've got a question on conditions.
All right. So for those of you who don't know, we offer any day effective dates for all of our products. So just to illustrate that, I am going to quote tomorrow as my start date here. The other thing that you folks should know is that we do not require Social Security number for any of our products, with the exception of Medicare and final expense. So we don't care if your customer is a foreigner, as long as they're in the United States legally, they're eligible. And so today I'm going to be quoting a female who is 46 years old. So I just put in some basic information. If you needed to add a spouse or dependent child, you would use these buttons down here. Now, when I click quote now, you'll notice the default product is our short-term medical product. And it's going to start asking me questions to determine whether or not I'm preferred or standard. So here's that question about having other coverage. It's going to want to know my height and weight. Put in a normal height and weight. And this is the rewrite button. So if you have written business for us, one of the things you need to know is if you're rewriting an existing short-term medical plan, please make sure you check this box. It's going to let us know that the person is already with us, number one. Number two, that they already have a life association membership. Remember, that's the thing we make you join in order to get our short term in the state of Ohio. The other thing that's important to note on this screen is over here on the right where it says questions, chat with us. This is super important, folks. This is not a chat bot. This is not a home office employee. Believe it or not, it's just hard to believe. This chat is manned. This chat is staffed by salespeople. So if you can't get a hold of me or anybody on my team and you're in a pinch and it's during normal business hours, please do not hesitate to click on this chat because there's someone waiting to take your chat. Okay, so it's now going to ask me, okay, answer a few more questions. We'll tell you if you're preferred. So I'm going to say no. So at least I get preferred rates here. And it's going to say view preferred rates. Okay, so here at the top, you'll see in the middle, if I choose monthly, I can begin to see the plans and pricing for our short-term medical. So remember, these are the enhanced plans with the $1 million maximum. This is where I think the smartest money is. In this case, I don't want to explain what coinsurance is. I'm feeling lazy today. So I'm going to give this young lady a $5,000 deductible 100% plan for $200 and change. And of course, now we have this thing. It's going to offer dental. So this is our no wait dental. I'm just going to skip it because we're going to take a closer look at this in a minute. But here we go. We have a 46-year-old female. She's got a $5,000 deductible 100% plan for $213. Folks, that's super competitive, but it could be even more competitive. And I'll tell you how. Number one, client can choose single payment. If I choose single payment, it's a 20% discount. It's important to note that currently we only offer single pay for policies lasting 12 months or less. We're going to change that later this year to do multi-year policies, but that's how that works. If they pay single pay 12 months or less, they save 20% of the premium. So going back to monthly, what you'll notice here is there's a drop down, right? There's a drop down box. So, and what I forgot to mention to you is if you look carefully in the cart, this is a 12-month policy. It's a sorry, I'm tongue-tied. It's a 2-year policy. And what's cool about it is it's telling you what the first year rate is. So if you look carefully here in the cart, it's saying the first year's premium will be $213 and change per month. And the second year policy will be $217.79. So this is all information that your customer knows up front. If you write in other states outside of Ohio, we can do something very similar, but we can lock your customer in for up to 3 years. So this is vastly different than our major competitor, because our major competitor, while they can sell your clients a multi-year policy, last time I checked, they couldn't guarantee what the rate is. So it's another hallmark of short-term medical where, I mean, even the ACA, there's no one, you call up healthcare.gov all day long, there's nobody there that's going to be able to tell you what the 2025 rate is going to be. But I can tell you right now, the out-of-pocket's definitely going to be higher, and there's a chance that ACA network's going to have a more narrow network. All right, so but we could also do, so just understand that this is set, it's preset to 2 12-month terms. So gosh, if you didn't, if you were just trying to cover someone on a waiting period between jobs, please make sure that you scroll down and do something that's less than 12 months if that's what your customer needs. So
or somebody bridging to Medicare, right?
Yes.
63.
Yes.
Perfect example, gang.
Can I jump in here, Phil?
I might be buying it for
question.
myself when I get there.
Yes, go ahead, Jeff.
Can you guys? Yeah, just a question related to the rating tool. Please restate the rating quick quote URL when time allows. If it was contracted
we'll type it in. I'll type it in.
If I was contracted with NatGen, am I good to go with Allstate?
It depends on what the agent's name is. If you, I mean, the chances are yes. But let's do this. I can show you the
old
URL.
Login, did the old login work?
Hold on a second. Let's do this. So it depends. So I mean, some of our agents back in the past, we were using quote it. So this is our own
I see.
homegrown
Okay.
software. So if you haven't
I
quoted in
see.
a long time, this is the
Okay.
new portal where you'll need to start your journey.
Yeah, and
Um,
Walt, if you want to call me if you're having issues with this new quoting tool, and again, that's ngahagents.ng.ic.com. That's
that's
the
correct.
new
I put
enrollment
it in the chat, everybody,
tool.
too, so you could just click
Yeah.
on that and you'll
Thank you,
have it.
And
gentlemen.
then,
Appreciate you.
and we're not ignoring these other questions. We will get to them at the next break, but
All right. Well,
soldier on, if you will.
I'm glad there's questions. Okay, so quickly, I'm rebuilding this quote. It'll just take a second. It gives me an opportunity to tell you how easy it is to get a quote here. So hold on. I just want to finish getting stance. No, no, no. Okay. So now we're back to preferred rates. Again, we're going to extend this young lady's coverage to 2 years. And as Brad mentioned, uh, it's a great bridge to Medicare because we're guaranteeing the rate. So that's huge. All right. So then we're starting to build what Phil Mishler would call a circle of protection for this customer. So this is a down and funky rate. This is a really good rate for health insurance considering it's a national network. But when I click on dental, what I can see here is if I add dental, I can save 15%. Okay. Everything you're seeing on this page right here is a no wait dental plan. If your customer's got bad teeth, they could buy this today and they could start getting their bad teeth worked on tomorrow. Okay. So this is the richest of the three plans. I actually have a brochure. I'm not going to brochure you to death today either, but what I wanted to show you is not that. Select dental. There we go, is just this little grid in the middle here. Let me see if I can make this bigger. Oops. The grid. There we go. Okay. So I always like to start with the richest plan. So if this young lady was interested in this prime plan, here's what she's going to get. Her dental coverage is going to start with a $2,000 maximum. If she keeps it to the third year, it grows to $3,000. Folks, that's richer than most group dental plans. From day one, she's getting 100% preventive, 60% basic, and 25% major in the first year. But what you'll notice is in the second year, major jumps to 50, basic jumps to 80%. So, and you might be asking yourself, Phil, all right, great. It sounds good. Who's the network? Well, before we get into that, there's also a vision. Oh, wait, I'm sorry. This is the copay plan. So we have this plan up here is no waiting period. In Ohio, we have this plan here, this copay plan 1. It does have a 6-month wait for major, but check it out. Everything on this plan is a copay. So I'd like to, Brad, you're my go-to person for today. If I told you, Brad, you need a tooth extraction this afternoon, you would have no idea what that extraction is going to cost you. It doesn't matter what dental plan you have, unless you have this plan, you wouldn't know. So, but with Brad's extraction, we break major into two categories. Low cost major is a $50 copay, and high cost major is a $250 copay. So the copay plan is awesome if your customer is willing to wait 6 months for major. If they can't wait 6 months for major, then these plans are good. So hopefully that makes sense to you. I didn't want to spend too much time in the brochure. So for $37.03, I'm going to add this, right? Then it's going to ask me for vision, which I'm going to say yes to. And here's why. If you look in the card here, you'll notice because I'm combining, and remember that all of these products are standalone. I happen to be bundling them together. And if I bundle short-term medical and the dental, I save about $8 a month, and that $8 savings basically allows me to have the vision for free, almost free, $2 a month. So
Phil,
I
you're
think
the male king of the bundle.
yes,
Well,
exactly.
there's a woman out there that some of the people may have heard of. She does the circuit pre AEP, pre OEP. She's actually a pretty big hitter, but I don't know. I like you better.
Well, I appreciate it. So you can
Yeah.
check the network. The network on this is Aetna as well. It's Aetna's dental network. It's turned on nationwide for service. The vision piece is Avisis. You might not have heard of Avisis, but Avisis is owned by Guardian Life Insurance Company. The vision piece has every major chain in America, including Sam's Club and Walmart, which our largest competitor does not offer both. So here's what I ask you to do. Check it out further when you get some time. I'm running up against my time limit here. So if you click on the fixed benefit tab, we have a product called Access. Access is a permanent health insurance plan that can cover you to age 65, and the rate never changes. It's health insurance with a rate that never changes. And then you might be asking yourself, Phil, sounds too good to be true. Uh, the reason or the way in which we get a health plan that's permanent, that where the rate never increases, if you went into the hospital, you're limited to $6,000 a day. Okay, that doesn't sound great, right? What I love about the access plan, though, is this value plan. If you get somebody who's young enough, the value plan, it's going to give them cash for office visits. It's going to give them cash for hospitalization, outpatient surgery, a whole bunch of things that that aren't listed here, and I don't want to pull up a brochure for. This rate will never change. So if I could get this young lady into, let's say, a 10,000 deductible 100% plan, I might be able to slip this in underneath of it. This access plan allows the customer to use any doctor, any hospital, or the First Health Network. But think about it, folks. It would be nice to have something that lays underneath your health insurance and spits out cash to help you with your out of pocket for everything from office visits to all the way up to inpatient surgery. All right, I think you get what I'm saying. But once you scroll, you click on the fixed benefit and you scroll down, you'll then begin to see the hospital expense protection plus. So what this is this is cash once per year if your customer is hurt or sick and hospitalized. It is a lump sum. They get that lump sum plus 150 a day for the first 10 days, and it's $29 a month. So I would definitely add this. I have a brochure. I just want you to look at the little grid very quickly. Hospital expense protection. Here's the grid. So I like the hospital expense plan C. Plan C is going to give this customer $5,000 once per year if they're hurt or sick and hospitalized, plus the $10 a day for plus 150 a day for the first 10 days. We actually include an observation benefit. Okay, so if you had a customer that went to the hospital, wasn't admitted, sometimes you wish they were admitted because they get a better benefit. But here, at least, we give them an observation benefit. You have a ground ambulance, but also an air ambulance. Here's a little known fact. The little known fact is the Allstate short-term medical does not cover air ambulance. But if you add this, if you've ever had a friend or a loved one medical evac somewhere, it's really, really expensive. So this is just something that you might consider. This does ask 3 health questions to qualify, but the good news is that if your customer is eligible for short term, they can definitely get the hospital expense protection. But if we click on accident, we have many guarantee issue products. Very quickly, we have a product called the Plan Enhancer. So if I take the Plan Enhancer and I buy a $5,000 benefit per accident, it's $24 a month. It's going to kick out the $12,000 per accident, or the amount of your accident, whichever is less. So if you have a $4,000 accident, you'll get $4,000. So I believe I did add that. Did I add this yet? Nope. All right, I'm going to add it. Then it's going to ask me for these 2 guarantee issue riders. Okay, so for those of you who don't know, CHS stands for cancer, heart, and stroke. So this is going to give my customer $5,000 upon diagnosis, not treatment. They'll get $5,000 if they get cancer, heart attack, or stroke, and they'll get $5,000 once per year if they're hurt and sick and hospitalized. Okay, so real easy to get because it's guarantee issue. So you didn't have to worry about any health questions. And this is a nice way. So let me see if there's anything else here. Really inexpensive term life insurance. Check note all health questions. We automatically issue coverage. And then we sell large dollar cancer, heart, stroke. So if you have a customer who's maybe they have a family history of cancer, you may want to consider a high dollar amount. This does ask health questions. But I just wanted to end with let's look at what's in this card very quickly. No wait dental plus a vision benefit, a hospital expense protection plan that's going to kick $5,000 a year to this customer. So this customer has the circle of protection. She knows that if she gets hospitalized, her $5,000 deductible is covered, whether she becomes sick or she's injured. Okay. Now I also added the plan enhancer, which you really wouldn't sell a customer double hospital coverage. I'm not even sure we'd let you do that. But with the plan enhancer, they get the $5,000 for the accident, $5,000 for cancer, heart, stroke, $5,000 if they get hurt or sick and are hospitalized, plus the short-term medical. All right, folks, my job is done here. This is a beautiful circle of protection for $358 a month. For those of you who aren't aware, we have a crazy competitive Medicare supplement in the state of Ohio with this really easy application. Too much to get into today, but what I did want to let you know is we have a senior dental. So let me just make this girl 10 years older. We do have a senior no wait dental vision hearing plan. What's cool about this one is if I took the richest option, it covers implants and dentures with no waiting period for $46 a month. All right. Let me pull up my team sheet. We can look at that in case people have questions. And then, are there questions?
Absolutely. You ready
Okay.
for the first one?
Yes.
Okay. Now this comes from Rod. If they pay, this is on the short term, and if they pay the single pay on the short term and acquire EGHP coverage, do they get a refund if dropping the plan? I'm not sure what
Yeah.
EGHP stands for. Maybe you do.
Well, let's
What
just
does it
assume
stand
it means they become eligible for some other kind of coverage.
Okay.
We will issue them a prorated refund, even though they've paid annually.
I think
So
Yeah, it just
EGHP
means
means group.
employer group
Yeah.
health plan. Yeah.
Yeah. So prorated. Fantastic. More questions coming in the door. Okay.
Nice.
So another question is under the pre-existing coverage questions, does that apply to sciatic nerve issues? Maybe you can look at
on
that
the
related to the
short-term
short term.
medical,
Yeah.
okay. So on short-term medical, we're
Yeah.
not
We
going to
just lost
cover
the present.
pre-existing anyhow. I just want to make sure
Okay.
I just want to wrap my mind around this question. So if you've got somebody who's got an ongoing condition that they want covered, I would not sell them short-term medical. But
I see.
yes, I can just explain how the short-term medical works. Uh, the health history questions go back 5 years, or that one particular question goes back 5 years on the cancer, heart, serious condition stuff. But once they're insured with us, the pre-existing condition look back is the 12-month period leading up to the effective date of the policy. Okay. So in that first year, let's pretend your customer bought a 2-year policy. In that first year of coverage, we're going to exclude. We'll use psoriasis as an example because it's a better example. Because I have psoriasis, I can just share some of my
Okay.
personal health history with you. So if I bought a 2-year policy in the state of Ohio, psoriasis is excluded in the first year, but in the second year, we'll actually pick that up. And the reason is because it's that look back that because they're buying two policies at the exact same moment, we can only look back that 12-month lead up to the effective date. So
Okay.
I hope that's answering the question.
Yeah, I think you did mention that you know, generic drugs would be covered though if
Yes.
they're
So
related to
here's how that
pre-ex.
works. If your customer buys the copay enhanced, which gives them the $5 million maximum, it gives them office visit copays, two per family member per year, and it gives them the $10 generic drug card. The $10 generic drug card covers pre-existing conditions even though the pre-existing condition itself is not covered under the medical portion.
Okay.
All right, let that sink in for a
Okay.
second, and
Yeah.
then
Yes. That makes.
the 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 caveat for whether the pre-existing condition is covered under the drug piece is the medical condition has to be a covered medical. The condition has to be a covered medical charge under the medical portion. So mental nervous not covered because it's excluded from the policy. So you won't be able to pick up your generic drug
Yeah.
with no pre-existing conditions because
Yes.
in
And
that scenario,
I've
because
had
it's a,
sciatic nerve issues before, and they do put you on, mental nervous meds
they do. Oh, okay. All
occasionally.
right. So
Yeah. So
there's
that
the
might
answer.
be
That's
excluded,
the
depending on
ultimate
what it is.
answer to the
Mhm.
sciatic thing, which is
Yeah.
if they're taking mental nervous,
Hmm.
that's not covered. So
Yeah.
So
We lost
would
your
what?
screen. You want to put up your
Yeah.
screen again?
But what
well, I
would
was
be
trying to find
right?
the team sheet, but
Oh, okay.
I can't find it. So I figured
So Phil,
actually let me.
in the instance that I do have sciatic nerve pain,
Yeah.
and I only get it treated with a chiropractor because he's able to work it out, and so no meds. It's only because of the med that's coming up in sort of the underwriting that would maybe exclude that case. So if they're taking uh, Adderall, maybe for a mental concern, but they also get a second or a secondary use of it for their sciatic nerve pain. So it sounds like they wouldn't pass underwriting, but maybe they're buying one of the other products like the dental vision, and then they're getting the option um, to buy the blah 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 blah.
Right.
Where's my
And
notes?
this is what I would say to
That's
you.
the association, the $15 association, getting the drug card.
Yep. So this is what I would always say. If it's gray, go ACA. Don't don't take the chance. If you're
Yeah.
unsure, well, and number one, you can always call in advance. But if you're unsure, uh, go ACA, and then you don't have to worry about it because ACA covers pre-existing conditions. It's there for you to take care of what you need to get taken care of. If it's a condition that is going to get better with treatment, you could get your condition covered with ACA. And that's a really important point that I forgot to mention, and that is that you really need to time your short-term medical policy to end during the annual open enrollment for the ACA so that if your customer develops a condition during the year that might not be covered well under a short-term medical, that they'll have the opportunity to jump onto an ACA policy during the annual open enrollment. What other questions you folks have?
So Phil, in that instance, right? So the 2-year sort of rate guarantee, if you're buying it mid-year, that wouldn't be an option, or
Yeah, it
would it?
would. Well, it
Okay.
would. There's a small amount of risk. So if it's me, let's pretend it's me and you, Brad, and you
Yeah.
wake up July 1st and you realize you don't have any health insurance. My standard tract on it would be to write you a policy from July 1st till December 31st, and then
Yeah.
write a second policy beyond that and
Uh,
lock you in for up to 2 years. The danger
nice.
there, and there's a wee bit of danger, is that Brad's health might change between July
In
and
December.
December, and you might not qualify for that next short term plan. But it's a pretty small risk, but it is a risk nonetheless. Now, of course, if Brad does develop that condition that makes him ineligible, like God forbid, Brad, I'm not wishing any of this
Yeah.
on you, but let's just pretend that you develop diabetes between July and December, you would just put that person on an ACA plan. So
Yeah.
I just think that that's your
Right.
smartest bet. You don't want it running out in July and then find out that they can't be rewritten. And you don't, losing your short term is not a life event that allows you to get ACA coverage.
Yeah. But I mean, if you think about that example, that's a great example how a 2-year option plan could turn into a 2-year and 11-month short-term plan. So
That's correct.
maybe you have that 35-year-old husband and wife who are relatively healthy, and they just want to play the short-term game for as long as they possibly can because they're not going to get a subsidy. So they just want to kick the can down the road a little bit, right?
Yes.
So, yeah. So, guess what? March and April are a great time to sell Allstate for that reason. Because then at the end of the 6 months, it will, or at the end of the year, puts them in the open enrollment period, and potentially in the extended open enrollment period, right? Wow, that's a
Right.
great. I gotta get healthy on one thing, and I'm gonna buy Allstate to bridge my Medicare when my wife, who's older, retires. Uh huh.
Are there any other questions?
I see no other questions that haven't been
Okay.
answered, Bill. So I
I,
think,
I will send you a copy of the PowerPoint,
yeah,
and I would just ask that if anyone has specific questions about being appointed, writing business, to reach out to Cornerstone and Brad and Jeff, or anyone on my team, we'd help you, get situated and set up.
right. Yeah, and Phil, I think I have them, but if you do have those brochures, send them to me that, kind of describe so that it's all in one email. Because then when she sends out the follow-up email to everybody, Jeff will just include the brochures. So
Gotcha.
maybe she might have to put them in a zip file. I'm not quite sure, but we shall see. That way everybody has everything. They have the recorded presentation for all of these interactions, plus they have the clef notes, and then they'll have all the brochures. So that's a great way to start. So I don't know if we can do it by, if you guys go into the chat box real quick, it's got the little messagey things. Let me know if you have or don't have Allstate contracted via us yet. Because then you just made Jeff and I a call list, or if you need it, just put in I need it, and so then Jeff and I can talk to you about it a bit more. I don't know. Should I get the Jeopardy clock going? Um,
And guys, I just want to say thank you. Like, thank you so much for setting this
you're
up.
welcome.
Yeah,
Yeah,
just appreciate the agents. Hopefully, you learned something today. And if you have interest in more in the supplemental or the short term, call me. I've got a lot of ideas. I've been doing this for a long time, and there's people on the call who are like, yes, I would like to double my income on each sale at the same time helping these customers that are, they're helping me provide for my family. Like, why wouldn't I try and help them with products that are really good for them?
yeah,
I hate to see someone that I love and care about shovel $8,000 out the door to the local hospital because I couldn't ask one question. I just hope that's not going to happen. But anyhow, if you're looking to do more in that space, please hit me up.
yeah. And I think if you use Phil's one-legged stool analogy, that's a great one, right? With the other two legs being your money, that's a great sales shtick, not scheme, but a really great shtick to put it in layman's terms for them, right? Make it
Yes.
easy because
Or
everybody
as I
comes
like
to
to
it to
say, nobody puts Brad on a one-legged stool, right?
you.
All right. Well,
Exactly.
I'll tell you what, this is one of the funner ones that we've run this week so far. Of course, it's early
Yeah.
in the week, but I just really appreciate you folks for letting
Yeah.
me do this. And
You got it, Phil. Thanks for joining us. I just want to wish early happy holidays to everyone, whether it's Easter or Passover. I hope you all enjoy your weekend or your week. Um, so yeah, enjoy family. That's what it's all about. And Phil, thank you.
thanks, everybody.
All
Take
right, you
care.
got it. Take care. Bye
Thank you,
now.
Bye now.
Phil.
Thanks.
Thanks, guys.